Hi everyone, 5-minute chat. We're back.
We're back.
Katie's hair grew.
I know, we've been posting some old videos, so I think my hair looks very short and long. That's why. What are we chatting about today, Eryn?
We're going to talk about perineal massage and how it relates to birth prep for a vaginal birth when you're pregnant.
Yep, we get a lot of questions about perineal massage. I think that it's become a little bit more common knowledge. Yes. There's been a lot of research released on it in the last 5, 6, 7 years now, so I think it's much better accepted in the birthing community. Yes. And it's one of those things where people are often curious about it, but maybe they're a little bit intimidated or they don't really know what to do, or they don't know why it's effective. So why don't you start by telling us, why might someone want to do perineal massage?
So I always joke with my patients, like if they come in for like say low back pain or SI joint pain, I'm like, oh great, I have you here. Can I talk to you about perineal massage?
Scare them away.
Yeah, scare them away. No, they're just like, wow. So perineal massage is a really easy technique to do. It's well received by individuals who are pregnant, and it's very effective. Like we have quite a bit of research to recommend that it's very effective at helping prevent perineal trauma and improving perineal recovery. So for us as pelvic floor physiotherapists, the easier that birth can be and the better the recovery, the easier it is for us and for the patient when we're trying to rehab after birth. So it's a technique that you can use. Generally, we say if you talk to your medical provider, like given you don't have any contraindications to it, like around like 30, 32 weeks is when I usually get people to start practicing.
Right. We always want you to check with your OB because there are a few people who shouldn't necessarily be doing perineal massage if you've got something like an active infection or if you're at a high risk of having preterm labor.
Placenta, like high risk pregnancies. So I always say if you have been told you cannot have penetrative intercourse or penetrative like vaginal penetration, then that's you're usually contraindicated from doing perineal massage. But again, you should always just check. So really, really strong research that
it helps reduce high degree tears. So those would be like your grade 3 and 4 tears that can affect the external anal sphincter.
Your risk of episiotomy, so when they actually have to go in and create a bit of a bigger opening to get baby out.
Forceps.
Vacuum.
So
and postpartum perineal pain is another big outcome.
And the other thing that's actually really cool is it's been shown to improve your confidence going into birth as well, which I think is a wonderful thing that we should be promoting.
And so people often say, well, like, how is it working? Like, am I stretching? Like, what am I stretching? What's happening? But the whole thing with perineal massage is you actually go in, you're working in the first layer of muscles of the pelvic floor. So levator ani is what that group is called. I personally, like, they don't have good research at knowing exactly mechanisms through which it's working, but we know it works. Mm-hmm. So when you go in and you stretch, I think what's happening is, to Katie's point, you're getting to know your pelvic floor better and you know what relaxed versus contracted feels like. And can you maintain a relaxed position or a lengthened position of the pelvic floor when you're applying stretch to it and pressure to the pelvic floor.
And that stretch and that pressure feels a little bit uncomfortable. So perineal massage shouldn't hurt, but it will feel a bit like a burning sensation. Mm-hmm. Or if you take your finger and you pull it back and you feel like that's stretching your skin, that's the kind of level that we're working towards in perineal massage. So can you maintain pelvic floor muscle relaxation while still feeling that slight discomfort?
And I find if you have not given birth vaginally or you've never touched your pelvic floor muscles, they can feel almost like tenderness. And so people often don't feel confident that they're in the right place.
Like ropey almost, right? Yeah.
And so it kind of feels like your Achilles tendon a little bit. So it's really important to kind of like get to know what that feels like. And it's a good opportunity to feel contraction and relaxation of the pelvic floor as well. And if you've had a baby or a previous vaginal birth, it's sometimes valuable too to feel like, are there areas that are a little bit more restricted? Do I have a bit of an obstetrical scar from my first birth? And you can spend some more time working there as well if that tissue is a bit tighter postpartum after you've had previous deliveries.
There are many different ways to do perineal massage. If you Google it, you will find 50,000 different ways. We tend to teach like 3 basic.
Are we teaching in this?
No, we're not going to do it today. We've got blogs out about that, but there's lots of different ways to do it, and so we encourage a combination of different ones that might be more effective for you. We usually teach 3 different methods, as I say, and like pick the combination that feels like it's offering you the most stretch. But you can go to our blog posts. You can look at our pregnancy bundle that we sell. There's lots of information out there that we have on how to do a perineal massage or book an appointment.
And if you're local to Moncton, or New Brunswick and you feel like coming to Moncton, we're hosting probably about a 4-hour pregnancy seminar in October. Follow us on social media to find out the details. Totally worth it if you want to meet our whole variety of practitioners that can contribute to your pregnancy journey and your postpartum journey, and just find out a little bit more about how we help.
Yep. So we hope to see you there. Bye.
I didn't like